Good afternoon, everyone, and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, New South Wales Multicultural Health Communication Service, and Multicultural New South Wales. I'm Jesusa Helaratne, your moderator for today. I'm the Deputy Director of the Multicultural Health Communication Service, and today we are so pleased to have again the Minister for Multiculturalism, Mark Coure, and of course, New South Wales Senior Medical Advisor, Dr. Jan Fizzell, to answer your questions and to give you updates. And we'd love for you to add your questions on the chat. We want it to be a lively discussion. Give us your comments and your thoughts. But before we begin, we'd like to acknowledge the traditional owners of the land from which we are all meeting today. We pay respects to elders past and present. And for Dr. Jan and myself, we pay respects to the Camaragian people of the Guringai tribe of the Eora Nation. And we'd love for you to add your name to the chat and tell us where you're all meeting from and joining us from. We'll also like to request if you can keep your microphones on mute, as we have only 30 minutes with Minister Coure and Dr. Jan, but please put your questions on the chat. So it's great to have you here. And now I'd like to introduce the Honourable Minister for Multiculturalism, Mark Coure. How are you today, Minister?
Thank you very much. Thank you. We've got problems with my video, but we're going to press ahead anyway.
Thank you, Minister. We'll see you later on your screen, but it's great to hear you. Please let us know how you are and if you have any updates.
Well, I certainly do have updates. COVID restrictions have already started to ease right across New South Wales, and there are no longer density limits in hospitality venues. QR check-ins will only be required for nightclubs and all musical festivals over 1,000 people. And you'll still need to check into hospitals, aged care and disability facilities. And singing and dancing will be permitted at all venues moving forward, which is great news. And as of last Monday, which is great news for everyone, particularly those who have got businesses in Sydney CBD, working from home will be returned to the employer's discretion, which is great news. So starting this Friday the 25th of February, you'll still need to require to wear masks on public transport and planes and indoors at airports, hospitality, aged and disability care facilities, correctional facilities, indoor music festivals with more than 1,000 people. We also encourage masks to be worn in all indoor settings where you cannot maintain that safe distance moving forward. Just a little bit about hotel quarantine. So as of last Monday, the government reduced the number of days required for unvaccinated people entering the state from 14 days to 7 days isolation. This week, we welcome international travellers back to Australia, which is great news for New South Wales and great news for Sydney after our nation's borders are now reopened after, I think, almost 2 years. And I'm sure many people would have read or listened to your publications. We'll be excited with this great news. International passengers travelling to Australia must obviously comply with Australian government entry requirements. So just as you would for any other country you travel to, so from Monday this week, all visa holders who are fully vaccinated for international travelling purposes can travel to Australia without a travel exemption. What else can I talk about? Look, just very quickly, obviously, and I mentioned this last time, now that our state is opened, Service New South Wales, Minister Dominello has done an excellent job on this. He's announced a $50 accommodation voucher will be available to help the accommodation industry in New South Wales and encourage people to travel in our state. So this is great news. It means that, you know, a one-off $50 voucher is available to all New South Wales residents 18 and over. And obviously for more information, the Service New South Wales website is the place to go. And I think I'll leave it at that.
Thank you so much, Minister, for that update and for the great news that you provided. Dr. Jan, any updates, but also please get your questions on the chat after that update from Minister Coure, and we'll get them answered. But Dr. Jan, it's nice to see you.
Nice to see you too, Jess. So the really good news today is our vaccination rollout continues with over 95% of the adult population having had 2 doses of the COVID vaccine. Children aged 12 to 16, 83.6% have received a first dose of COVID vaccine, 79% have received 2 doses. So we can still improve those numbers. We still have 46.9% of children aged 5 to 11 who've had a first dose of COVID-19 vaccine, and remembering that even children can get severe after effects of the COVID infection. So we still very much recommend that children do get that vaccination. And today I understand that we now have 2 vaccines available to children, with the Moderna vaccine approved by the Australian Technical Advisory Group on Immunisation for use in children aged 6 to 11. Of people aged 16 plus, 52.2% have now had their 3rd dose, which is 56% of the people who should have had a 3rd dose by now. So we've still got a lot of people who are missing out on that extra protection that that 3rd dose of vaccine will give them. So please do look at our vaccine finder on the newsouthwales.gov.au website to find out where people can get that 3rd dose. We are still seeing a large number of people with COVID-19 diagnosed with both PCR testing, and we've still got PCR testing clinics across the state, as well as by the rapid antigen tests. And we had, she looks very carefully, around about, oh, the number's gone from me. I think we had around 8,000 cases registered yesterday. We did, however, sadly lose 6 people to COVID-19, 4 women and 2 men. Some of them had significant risk factors, remembering that as we get older, COVID-19 can be a very serious illness. So please, if you have any older members of your community, please do reach out and ask them to get their boosters. And our condolences with all those families who have lost somebody. We've currently got 1,246 COVID cases admitted to hospital, including 69 people in intensive care, 29 of whom are on ventilators. It was 8,931 that we had yesterday, notified by PCR and RATs, and we did have 35,000, nearly 36,000 PCR tests conducted yesterday. So remains a very important thing that if you are using a rapid antigen test, to register that result with Service New South Wales so that you can get our survey to link you into care if required. And the same when you have a PCR test, you'll receive an SMS message asking you to respond. That survey helps link you into care if it's required.
Thank you so much, Dr. Jan, for that update. And again, if you have any questions, please put them on the chat and add your names to the chat as well, and let us know where you're joining from. And a question here, we'll start with the question for Minister Coure. The announcement of the easing of rules around New South Wales is causing a bit of concern for safety from the community. Any comments on this?
Well, yes, thank you. And hopefully my camera is now working. Look, the New South Wales government is taking a staged and flexible approach to the easing of restrictions, and we have all felt the challenges of the pandemic over the last 2 years, and we're focusing on easing out those restrictions so we can, sort of help us get back to normal as quickly as possible. We have an incredibly high take up of the vaccine, which is one of the key factors of helping us get back to normal. Obviously, the challenge for us is ensuring that the next challenge for us is obviously making sure that communities are taking up the booster shot, and of course the booster shot is critically important to ensure that we get out of this pandemic as quickly as possible.
And when you mentioned about the booster shot, why isn't Novavax approved for booster, Dr. Jan?
The Novavax vaccine is still a new vaccine. It's still providing data to the Therapeutic Goods Administration. I don't believe we've had enough data yet to be able to say how effective and how to use it as a booster. So when that information's come through, it'll be approved by TGA and then approved by the Technical Advisory Group on Immunisation with a recommendation as to who should use that vaccine. And that's the process. So at the moment, I understand that they're still accumulating the information about using Novavax as a booster.
Thank you, Dr. Jan. Question here, Minister Coure. People are going to shops now and there's no need to check in through the QR code. Some have been used to the COVID-19 alerts that they receive. Any comments?
Look, that's right. As of Friday, the 18th of February, QR check-ins will only be required for nightclubs and for all music festivals, and for all music festivals with more than 1,000 people. Hospitals, as I said before, aged care, disability facilities may use their existing systems for recording of visitors, but we've had an incredibly strong take-up of the vaccine, and people have been doing the right thing right across New South Wales and right across Sydney by monitoring the symptoms, getting that health advice, getting tested, and when positive, do the right thing and self-isolate. It is because of the communities right across New South Wales that have been doing the right thing and have been able to access the right information, and I'll get to information and translations in a second, which you've all played a vital role in helping us with, that we're able to reduce some of the requirements, which is great. It means that we're getting back to normal.
Thank you, Minister. And I guess, Dr. Jan, what is it that the media, multicultural media, should be just emphasizing in terms of requesting people to get vaccinated and to stay safe?
Look, I think the key things are about continuing to reassure the community that our experts are working really hard to look at all the information that's coming around internationally and translate that information for the Australian context. We've been very fortunate. We haven't had large waves of infection that have caused, huge amounts of hospitalisation. We've seen a lot of people very sick and suffering, no doubt about that. But nothing particularly as bad as we have seen overseas. So I think the thing is we've got to make sure that the information that's being provided about immunisation programs, we learn. We're still 18 months into these programs. We're improving what we're doing. And I think this is why information is changing. The more we learn, we don't want people just to stay with something because that's what we used to think. We've got to move people to where the new information is, and we've got to change our practice when there's better information available to us. And so that's why information does change. So I think supporting the community and understanding that a change doesn't mean confusion. It means that we've learned something more and that we can give good advice to match that learning that we've done.
Thank you, Dr. Jan. Minister Coure, one of the questions has been asked here is why did they remove masks from schools?
Well, that's a really good question. Today, the Premier, along with the Minister for Education and Early Learning, Sarah Mitchell, announced changes to help give students, a chance to normal school life again, to go back to normal school life again. Since the pandemic began. So what was announced as of Monday, or from next Monday, the 28th of February, cohorting requirements and activity restrictions will be relaxed, which is great news, enabling students to engage and interact with other students throughout the school and freely across the class and year group. Schools will be able to welcome new visitors into the school grounds, including parents, and will resume activities such as school camps and assemblies. And certainly as a parent with 2 kids, that's great news. It means that, we're able to enter the school playground and the school grounds when dropping off or picking up kids. Mask requirements will be lifted for high school students and staff. And as of Monday, the 7th of March, so that the Monday or 2 after, mask requirements will be lifted for primary schools and early education staff. And staff in schools will continue to be required to wear staff in schools, in particular schools, for particular purposes, will continue to be required to wear masks based on the health advice, which is great news. It means that, schools now will also be freeing up as well.
Thank you, Minister. A question here in the chat. When booster rates are low and international travel are resuming, why remove mask mandates? And I guess you've answered that if you that it is important for normalizing for schools. But Dr. Jan, maybe this question is about how important it is from a health point of view.
Look, I think the thing is that many of us are now triple, or in the case of immunosuppressed people, quadruple vaccinated at this point. And at some point, infectious diseases have been with humans ever since humans have been. And I think what we need to do is look to see what will the masks help us with. And the masks will certainly help us with protecting ourselves if we're in an indoor crowded environment, or if we're in an area where we're not certain, or if we know that it's a place where people may not respect our personal space. And then we can make that choice to wear the mask to reduce our risk to ourselves. And again, we also need to take that responsibility that if we're feeling sick, we're not going out and about and spreading any illness in the community. So I think what it is, it's about trusting our fellow citizens to look out for each other so that we wear our masks when we can't socially distance, and we make those choices. If somewhere doesn't look safe, we don't go. And we're responsible and get tested and stay home as we're asked to if we're unwell.
Thank you, Dr. Jan.
And if I can just add to that as well, as Dr. Jan said, if it's been 3 months or more since your second vaccine, your second COVID-19 vaccine or vaccination, obviously it's time to get that next shot. And that's something that we're pushing right throughout New South Wales, particularly in our multicultural communities. Get out there and get your booster shot.
Thank you, Minister Coure. And just on that mask matter in question again, is that also businesses are with using a mask with the retail. It is important just to keep people safe, isn't it?
Look, it certainly is absolutely important to keep people safe. But moving forward, once the economy is starting to open and people are getting those booster shots, then we'll be able to slowly return back to business.
Thank you, Minister Coure. I guess the question about up-to-date vaccination, which Minister Coure, Dr. Jan, this is a question here about the concern from the community that the term up-to-date vaccination status is very confusing. Also, that this term is being misconstrued or being misinterpreted as mandatory. How can we ease the concern in the communities?
Look, I think something that we know is that there are certain times when we're meant to have different vaccines in our life. And if we haven't had them at a certain time, people will be offered a vaccine to protect them when they become at risk. So a good example is the tetanus shot, where you will have been vaccinated as a small child. You will have probably had a booster if you went to school in Australia when you're at high school. But then later in life, you may have an accident. And I will ask you as a doctor, have you had your recent tetanus shot? And if you haven't, you're not up to date, and I will offer you a booster to try and prevent that terrible infection. And this is the same thing, that with people having a primary course of immunisation, either 2 doses for people who've got great immune systems, 3 doses for people who are immunocompromised, we're now offering people that booster dose to try and get that protection in. Now, for most people, that's about protecting yourself. But for some people in certain industries like healthcare and aged care, where our clients and patients can get so very, very sick from COVID or sick from flu, there are a number of different diseases. As a healthcare professional going to work in a New South Wales health facility, I have to show that I'm up to date with those vaccines, whether they're hepatitis, whether it's chickenpox. There's all sorts of diseases that I've had to either be vaccinated against or show immunity from. And that's to protect the patients when I'm looking after them. And so I think this has been part of our culture. But I think there are some people who are concerned, but we're trying to help them understand we're getting huge amounts of data about this quality and safety of these vaccines, and it will help protect them, because we haven't seen a lot of healthcare workers infected at work. What we're seeing is when they go home and look after their kids or go out with friends, just have a normal life like they so deserve at the moment, we pick up COVID just the same way other people in our community too. So it helps prevent us bringing it from home or our social events into our workplace where we're looking after vulnerable people. And I think that's the key thing. It's mandated where we're looking after vulnerable people, but for everyone else, it is so very much encouraged, because, as I say, your immunity can wane, particularly with this new variant Omicron, and that's why that booster dose is so important for the community.
Thank you, Dr. Jan. And Minister Coure, I mean, just going back to that question, how do we ease these the concern of the communities in terms of communication to multicultural communities?
Look, it's a really good question, and I think I do want to acknowledge the great work of New South Wales Health and Multicultural New South Wales. We've also may have Service New South Wales on this Zoom as well. Look, we're working closely with New South Wales Health, Department of Customer Service, and Multicultural New South Wales, all working as a team, really to ensure those important health messages are being translated right across New South Wales, but particularly for those multicultural communities. The government's weekly COVID-19 toolkit is still very, very useful source of information in language with over 10 different languages. And there's information there on, again, booster shots, importance of vaccination, importance of registering a positive rapid antigen test, and much, much more. There is a lot of information there. And I really just want to, and I know I say this all the time, but it's really important, thank the multicultural media for the great work that they're doing. They've really stepped up and done a great job in helping us communicate those important messages out to the communities, because we can do so much and we can only translate it, but it's up to multicultural media to be publishing that either through their paper, their radio, or their television, or online. So thank you to all of you on this Zoom today, because by publishing it in your media, you're then sending that through to the community itself.
Thank you, Minister Coure, and I agree with you that it's just really the hard work of the multicultural media delivering these information in language to their community. So we'd love for you to send through or write your links, put your links on the chat so that we can see the hard work that you've done, and share your resources with us as well. And for any questions, please add on to the chat. A question here, Dr. Jan, is what is our next step about the vaccination protocol as some European countries starts their fourth shot of COVID-19 vaccine? Are we preparing for that? This is by Dr. Bojra Al-Obaidi from the Iraqi Australian University and the Graduates Forum, board member of the Iraqi Australasian Medical Association. Thank you, Bojra, for that question.
So for people who are profoundly immunosuppressed in Australia, they're already recommended to have that fourth dose of vaccine as a booster dose after they complete that primary course of immunisation. For the rest of the community, our technical advisory group on immunisation will continue monitoring the data from overseas. There are some really exciting vaccines in development. There's Omicron-specific vaccines, but there's also vaccines being developed that will not be so dependent on having to fight a particular strain of COVID-19. And at the moment, given that we've still got a whole lot of kids to vaccinate, a whole lot of young people to vaccinate, and a whole lot of adults to get that third dose in, I think it really does mean that we need to turn our minds to how do we help those people who've been hesitant, who have been concerned across the line, to give them the same sort of protection as the people who have taken up the opportunity for vaccination have. So I think it's okay for us to be pausing and waiting at the moment for better information to come in about when to do a fourth dose, if to do a fourth dose. Would it be a different type of COVID vaccine that we would recommend for a fourth dose? We've still got a lot to learn. And I think it's a good idea that while we're learning, we wait and we make sure everyone else, though, has that opportunity to get the booster, to complete their primary vaccination course if they're a young person, and particularly for the little kiddies, to make sure that they've got that vaccination. Because with a 1 in 1,000 chance of children getting that severe multi-system inflammatory condition that can occur after COVID, that's not nice. So we've still got a good reason to get the kids vaccinated as well.
Thank you, Dr. Jan. And Minister Coure, this question about that some European countries are starting their fourth dose. Should we be following other countries, or should we just be aware of what's happening here?
Well, I think it's important to be aware of what's happening overseas. And there are some countries that are very good examples to at least be following. But at the end of the day, keep in touch with your doctor, follow the health advice from New South Wales Health and the key government messages. And as I mentioned before, those key government messages are being translated every single week to get out there into the community for multicultural media to send and publish, and also for the publishing by the multicultural community groups. And again, my hat goes off to all those involved in making sure those translations occur as quickly as possible.
Thank you, Minister Coure. I guess a question about traveling into Australia now, and fully vaccinated and unvaccinated, and traveling interstate. Minister, any updates on that, or any comment?
Well, there certainly is. I'm sure everyone is excited to hear, I know I certainly am, that we're now opening up and welcoming back international travellers to Australia and New South Wales after our nation's borders were reopened. They were closed for just under 2 years. From Monday, last Monday, 21st, all visitor holders who are now fully vaccinated for international travel purposes can now travel to Australia without a travel exemption, which is great news. However, unvaccinated visa holders or any famous tennis players will still need to be exempt, will still need to be in an exempt category or hold an international travel exemption to enter Australia. So from this Monday, 21st of February, or last Monday, I should say, hotel quarantine also has been reduced from 14 to 7 days. And anyone wanting to travel to Australia, there is a checklist available via DFAT, the Australian Government Department of Home Affairs website, and I think Service New South Wales as well.
Thank you, Minister Coure. Maybe a question a lot of people are asking now that it's been reduced for 14 days, from 14 days to 7 days. What is the explanation for that, Dr. Jan?
Look, I think, again, it's a pragmatic thing that when we have a high level of COVID circulating in our community and we have a highly vaccinated population, the risk is reduced. So most people, if they've picked things up before they travelled, remembering that they will have had a negative test potentially before they got onto the plane because of airline requirements or other requirements of countries they may have passed through. And then when they get to Australia, if they've come from overseas, there's still always a small risk that people will bring in something from overseas. And if you're completely unvaccinated, the risk that you will bring in that strain is much, much higher. Having said that, you'll probably manifest that disease in that first 7 days. But it does mean, though, for all of us, whether we've just come back from overseas travel, whether we've been with people out for an evening out, if we're not feeling well, the key thing will be to either do a rapid antigen test if we've got one available to us, or go and get a PCR test at one of the New South Wales health clinics and just double check that we haven't developed COVID-19. I think the other thing is, we do ask people who are coming in from overseas to be really aware of not necessarily going straight to aged care facilities, hospitals, and so on. And that's particularly important if people are not vaccinated, simply because the risk that they will take something with them is unfortunate, but it's there. So please do follow those New South Wales health guidelines. They'll be up on the web to help you understand what the obligations are for people arriving from overseas, particularly as far as going to higher risk settings such as disability care homes, aged care homes, hospitals. But also it's something to think about if you've got older relatives or friends coming from over, or you have your own older relatives here and you've got young people coming from overseas, thinking about how to be COVID safe in those first few days of them being here, meeting outside, having picnics, not the best weather for it today, but, generally not having that intensity of indoor, poorly ventilated contact just in that brief time when somebody's there, or using those rapid antigen tests before you have that family reunion.
Thank you, Dr. Jan. And Minister Coure, how ready is the country, is the state for these new arrival of having opened the borders?
Well, I think we're ready, and certainly that's what the health advice and the government advice has said. We are certainly ready, and we'll continue to monitor the situation. I think it's good that we're obviously getting back to normal. In one way or another. And I think, obviously, and I should also point this out, the government has also distributed over just under 100,000 tests to multicultural community organisations as well, as more supply, the rapid antigen tests, as more supply becomes available. And, we continue to work with many of the multicultural groups in the space here to ensure tests are delivered to vulnerable communities. So, and those rapid antigen tests, and you've heard me say this before, they're out to temporary visa holders, asylum seeker groups, refugee groups, ethnic communities councils. So we're certainly doing our bit. To answer your question, we are certainly doing our bit in this space to ensure that our communities are ready with the booster shots, with the vaccinations, with the rapid antigen tests, to ensure that when we do open up, or when we have opened up, we end up, when we do open up, our communities are safe.
Thank you, Mr. Coure. Alan from the Middle East Time International. He has a question about the flu season with international travel. Flu season is coming.
Yes, we've already had some of our first cases of people who've had flu. So flu, we've been really lucky for the last 2 years because flu is also challenged by the same things that the COVID virus is challenged by. It's basically died out in hotel quarantine when people still had to quarantine, and it wasn't circulating in our community. Now that people are arriving from overseas, the flu virus is back in Australia, and we are starting to see some outbreaks in aged care, and there are people who have got flu. So I think that's the really important thing, that if you do have respiratory illness at the moment, it is important for us to stay home, because flu can be devastating to older and vulnerable people too. And again, we'll see our influenza vaccination campaign start in the next couple of months, and encouraging people to not forget to get immunised against flu, because one of the things could be that because we haven't had flu circulating in our community for the last couple of years, people's immune systems might not remember flu that well. So we may see more severe illness. So it will be really important for us to stay safe in flu season as well. We will be having testing protocols, for example, in hospitals. So people get tested for COVID. If it's not COVID, testing people with a flu compatible illness for flu will be happening. And again, same with aged care facilities. People who have respiratory illness, the first test that we'll do is for COVID, because at the moment COVID's more common than flu. And then if it's not COVID and the person's unwell, they'll be testing for flu. So I think it'll be something that we'll see more of this year. But again, the things that we do to help prevent us catching COVID, not being in crowds, wearing our masks, keeping our hand sanitizer going, will all help us with flu as well.
Thank you, Dr. Jan. Minister Coure, we've run out of time, but any last comments and feedback for the community?
Look, just a couple of comments. Look, thank you again to the parents, the teachers, the students, the school administrators and the principals right across New South Wales, ensuring that we're able to return students to classrooms safely. And certainly we're continuing to support face-to-face learning by offering those rapid antigen kits to students and to staff and so forth. When necessary. So a big shout out to everyone involved in getting schools back online and kids back in the classroom. Again, another shout out to all our frontline staff. They are our unsung heroes during this pandemic, and a big thank you to all of them, to the contribution that you have done. It certainly isn't easy, and I really want to thank you on behalf of the government for everything you've done to ensure that our communities are safe. And a big shout out to New South Wales Health, Multicultural New South Wales, and obviously Victor Dominello's Department of Customer Service, and to the Department of Education for the service and the work that you have done as well. Again, so a big thank you out to all of you. And look, thank you to the multicultural media. Look, it's easy or easier to have our material translated, but it's much more easy once, of course, it's published in the network of our multicultural papers, the websites, the radio, and published on TV. So thank you to the work that you have done. I mean, we can't do this alone. And by communicating the latest information from New South Wales Health or from the government or from any department is only as good as when it's published. And thank you to all of you for the work that you have done. So thank you.
Thank you so much, Minister Coure, and for always joining us and your commitment to the sessions and providing information to multicultural media. Dr. Jan, any last words?
Just to encourage people, keep encouraging your community to come forward for vaccination, keep encouraging those outdoor meetings and greetings and family reunions as we move into our new world of being able to be more together, which is just so exciting and wonderful, because the mental health stress for so many people being separated for so long, and seeing some of that alleviated in the coming weeks is just amazingly joyful, I think.
Oh, thank you so much, Dr. Jen. And I agree with you that it's important to be gathering together with our families, but in a safe way, as you always say. So thank you so much for joining us again in the Multicultural Media Online Forum, hosted by the Ministry of Health, the Multicultural Health Communication Service, and of course, Multicultural New South Wales. We're so happy that you join us every week, and we'll see you again next week. Stay safe and get vaccinated and keep pushing that message. Thank you.
Thank you very much. Take care.